Hello, my name is Philip Gaudreau, and I'm a pediatric otolaryngologist in San Diego, California. I would like to discuss the risks and common items associated with choking in children. Choking occurs when either food or non-food items enter the airway. This can result in coughing, wheezing, or severe difficulty breathing. Children between 6 months and 3 years old are increasingly mobile and often explore their environment by placing things in their mouths. They are also learning to eat new foods and don't have all of their teeth. This places them at the highest risk for choking. Choking in children may occur as a witnessed or unwitnessed event. The most common thing a child will do is have sudden onset of a cough. They may also have gagging or vomit or have new noisy breathing called stridor or wheezing. In a severe choking event, children may not be able to breathe at all and may appear to turn blue. This is an emergency requiring immediate intervention. Some children may have very mild symptoms initially, but have new noisy breathing or a persistent cough without other common cold symptoms like runny nose or fever. The most common items for children to choke on are foods. The highest risk foods are small nuts and seeds, with peanuts being the highest risk. Despite it being safe to give peanut butter to younger children, whole peanuts or other nuts should not be given to a child younger than 4 years old due to the risk of choking. Popcorn and other seeds, such as pumpkin seeds or sunflower seeds, are also high risk. Other foods that can be a risk are hot dogs, hard candies, and raw fruits or vegetables such as grapes, berries, and carrots that are round. Children should also not have chewing gum until age 5, as this is another high-risk item. Non-food items that children may choke on include small toy pieces, balloons, marbles, coins, rubber bands, magnets, hair ties or barrettes, or pen and marker caps. A very high-risk item is a button battery that is commonly found in watches and other small electronics. Even without airway blockage, choking or swallowing a button battery is an emergency and needs to be removed as soon as possible. If you witness your child appear to choke, allow them to cough to see if they bring the item up on their own. If they are not coughing or appear to be struggling to breathe, infants less than 1 year should have 5 back blows alternated with 5 chest thrusts to attempt to dislodge the item. Children older than 1 year should have abdominal thrusts or the Heimlich maneuver performed to attempt to dislodge the item. If this is not effective, you should dial 911. Please talk to your pediatrician about the appropriate way to perform these potentially life-saving interventions. If your child continues to cough or you have continued concern that they have something in their airway, they should be evaluated in the emergency department, where they will be examined and may have x-rays taken. If there is high enough concern, or if you witness your child choke on something, they may undergo a procedure under anesthesia called a bronchoscopy. This involves an examination of the airway in the operating room and removal of any items that are found. The most important step you can take is to prevent your child from choking in the first place. Don't allow your young child to play with toys that contain small pieces or the items previously listed as high risk. Don't give your child food items that they are not yet ready for. Do not give nuts and seeds to children less than 4 years of age. Raw fruits and vegetables should be cut into small pieces. Children should be observed while eating and should be seated upright, not walking or running or lying down. Talk to your pediatrician about learning the correct way to do back or chest thrusts and abdominal thrusts. In conclusion, there are many common items that can present choking hazards to young children between 6 months and 3 years of age. Being aware of the common food and non-food items and keeping them away from your young child can help to prevent a choking event. Discuss the potentially life-saving maneuvers of the back, chest, and abdominal thrusts with your pediatrician so you can be prepared in case a choking event occurs. If you are unsure, have your child evaluated by your pediatrician or in the emergency department so they can determine if a specialist evaluation or additional testing like an x-ray or a bronchoscopy is required. For more information, you can also visit www.healthychildren.org and search for choking prevention. This website provides great additional information and resources to help prevent choking in your child.